Hello, my name is Angela Westover. I am an MN 590 student with Purdue Global University, and I would like to thank you for joining me today for the Nursing Workstation Ergonomics program, Course 1 on Biomechanics. One of the program objectives related to this specific course is to expand the nurse's understanding of biomechanics. There will be a post-test at the completion of this full program. A pre-test should have already been completed. These tests will help to determine whether or not the nurse's understanding of biomechanics has been expanded. So what exactly is biomechanics? It is a science that is concerned with internal and external forces acting upon the human body and the effects produced by these forces. Understanding terminology that's related to anatomical locations, planes of motion, and joint movement is important for understanding and applying principles of biomechanics. So we'll begin by discussing the human movement system. The nervous, skeletal, and muscular systems are all considered parts of the human movement system. These systems work interdependently to produce efficient human movement. The human movement system is also sometimes referred to as the kinetic chain. The checkpoints of the kinetic chain include the foot and ankle, the knee, the lumbopelvic hip complex, the shoulders, and the head and cervical spine. As mentioned, understanding anatomical terminology is helpful in understanding biomechanics. But to review, when discussing anatomical location, we must begin by referring to the anatomic position. This is a position where the body is erect with the arms at the sides and the palms facing forward. With this as a reference, we can understand that superior refers to a position above the reference point, inferior refers to a position below, proximal refers to a position nearest to the center of the body or reference point, distal refers to a position away from the center, anterior refers to a position on or toward the front of the body, posterior refers to a position on or toward the back, medial refers to a position relatively closer to the midline of the body, lateral refers to a position relatively farther away from the midline or toward the outside. Contralateral refers to a position on the opposite side of the body. And finally, ipsilateral refers to a position on the same side. Although it's not necessary to be included, I've included a link for a YouTube video that's helpful for further review or reference. We must also understand planes of motion, or imaginary bisectors that divide the body into different segments. The transverse plane bisects the body into top and bottom halves. The frontal or coronal plane bisects the body to create front and back halves. And lastly, the sagittal plane bisects the body into right and left halves. Again, this is according to anatomic position. It is important to understand that movement is said to occur more commonly in a specific plane if it is actually along the plane or parallel to it. Some movements are on a one plane dominant, but often movement occurs on many planes of motion. Arthrokinematics refers to the motion of joints in the body such as rolling, sliding, and spinning. A roll is a rotary movement with one bone rolling on another. A slide is a transitory movement with sliding of one joint surface across another. A spin is also a rotary movement with one body spinning on another. Motion often uses the principles of levers, so understanding muscular leverage is an important concept of biomechanics. A lever is a rigid bar that pivots on a stationary fulcrum or pivot point. Within the body, bones, muscles, tendons, and ligaments create a series of levers and pulleys that generate force. Muscles pull on the bones, and different muscular attachments determine how much force is actually capable of being generated. So in the human movement system, a lever system of a joint consists of a joint axis acting as the fulcrum, bones serving as the lever, muscles as the motion or effort, and the weight of the body part or an object as resistance. Again, it's not necessary, but I've included a link for a YouTube video that will be helpful for further reference or to review joint levers as they relate to the body. Levers are classified by first, second, and third class depending on the relation among the fulcrum, the effort, and the resistance. First class levers have the fulcrum in the middle. An example of this would be head nodding. In this case, the spinal column acts as the fulcrum. Second class levers have the resistance in the middle. An example of this would be calf raises. The ball of the foot acts as the fulcrum, the body weight is resistance, and the calf musculature applies the effort. Third class levers have effort placed between the resistance and the fulcrum. An example of this would be flexing at the elbow or performing a dumbbell curl. The fulcrum is the elbow, the effort is applied by the bicep muscle, and the load is the weight in the hand. So now we'll look back again at the planes and apply the concept of motion or joint movement. In the transverse plane, joint movements include internal, external, left and right rotations, as well as horizontal adduction and abduction. In the frontal plane, joint movements include adduction and abduction, lateral flexion, eversion, and inversion. In the sagittal plane, joint movement may be flexion or extension. I've included a link for a YouTube video here that is humorous as well as helpful for your review. So again, the human movement system may sometimes be referred to as the kinetic chain. Neuromuscular efficiency is when the neuromuscular system is able to properly recruit muscles and produce force or reduce force and dynamically stabilize the entire kinetic chain in all planes of motion. If one or more of the segments of the human movement system are misaligned, predictable patterns of muscle imbalance will occur. These are referred to as postural distortion patterns. Pattern overload can occur from consistently repeating the same pattern of motion as it places abnormal stress on the body. Repetitive stress injuries refers to the damage and pain that is caused by the repetitive movement and overuse. The image here suggests some repetitive stress injuries that can potentially occur from different overload patterns. The cumulative trauma cycle is a process that occurs when there is a dysfunction of connective tissue. These dysfunctions are treated by the body as being an injury, and it will therefore initiate an attempt to repair the dysfunction. When trauma occurs to the tissue, it creates inflammation, which then triggers protective mechanisms such as muscle tension. Increased muscle tension then causes spasms, which includes some areas of heightened microspasms. The increase in muscle tension and spasms can result in myofascial adhesions or knots. These adhesions disrupt the length tension and the force-couple relationships, which then result in various dysfunctions and altered neuromuscular control. Lack of neuromuscular efficiency, such as poor posture and repetitive movements, can further create dysfunction of the connective tissue or muscle imbalances, which then brings us back to the beginning of the cumulative trauma cycle. Consistent repetitive stress to the joints and muscles, along with improper mechanics and faulty recruitment patterns, puts an individual at high risk of being subjected to the cumulative injury cycle. Work-related musculoskeletal disorders, or WMSDs, are conditions that occur and/or get worse due to the work-related factors such as work environment and performance of work. In the United States, WMSDs create an economic burden that's estimated to be between $45 and $54 billion every year. Healthcare occupations have some of the highest prevalence of work-related musculoskeletal disorders. Globally, nurses have considerably high incident rates of WMSDs. Here you can see results provided from one of the many studies which aim to determine the extent of problems in the prevalence of WMSDs. Although the findings vary by study, neck and shoulder are commonly found to have higher rates of injury, especially amongst computer workers. Back and knee pain are found to have high prevalence rates in studies related to general ergonomics. You should now have a better understanding of how poor body mechanics can put individuals at risk of being subjected to the cumulative trauma cycle, which therefore increases the risk of repetitive stress injuries and work-related musculoskeletal disorders such as bursitis, tendinitis, carpal tunnel, trigger finger, and more. With this knowledge that has been gained, you should now be able to identify errors in biomechanics, aim to realign the checkpoints of the kinetic chain, and look to improve technique and positional habits. This will help to prevent injury and optimize performance overall. One critical injury prevention method that we will learn about in the next course in this program is ergonomics. This includes preparing your body by stretching and strengthening exercises, maintaining a good posture to limit muscle tension and prevent straining, avoiding destructive behaviors by practicing good technique and practicing healthy work habits, and optimizing your workspace by making any adjustments as applicable. In summary, for this course, we define biomechanics as being the science that is concerned with internal and external forces acting on the human body and the effects produced by those forces. We discussed the human movement system, or the kinetic chain, and the checkpoints to be aware of for maintaining postural alignment. We reviewed anatomic location terms, planes of motion, and joint movements. We looked over arthrokinematics, including the different motions of joints, as well as muscular leverage, including the different classifications of levers. We applied those concepts to joint motion, observed positioning, and assessed movement patterns. And finally, we began to identify the relationship between biomechanics and work-related musculoskeletal disorders. Again, I thank you for joining me for this course, and I look forward as we move on to NWE 2, Computer Workstation Ergonomics.